Lisa, let's talk a little bit about the types of contraception that's
Okay.
available, because I think people, in this day and age, when you hear about birth control, you think the pill.
Right.
But let's talk about the range of
There's
contraception
actually
that's
a
available.
great range, and different women have different lifestyles that lead to different methods that work for them. The pill is a great method. One of the downsides, though, is that you have to remember to take it every day at the same time. For some women, that's fine. They get up at the same time, or they go to bed at the same time. It's a great method for many women. Another option is the Ortho Ever patch. It's a patch that can be worn on the body. It looks like one of a smoker's patch, about this size. It can be worn on the arm or under the underwear line. You only change it once a week. So you keep your patch on for a week at a time.
So hormones are constantly through the skin.
Exactly.
They're going into your body.
Yep, it's not ingested. It's transmitted through the skin, where for a week at a time for 3 weeks, and then you're off for a week to have your period, just like you're taking the pill every day for 3 weeks, and then you have it off for a period. The next option is the NuvaRing, which isn't getting as much publicity, but we really like. I mean, it's a great option because it's a small plastic ring, probably about this diameter. It's inserted into the vagina for 3 weeks. So you put it in, don't have to think about it for 3 weeks.
You don't feel it. You
don't
know
feel
it's
it.
there.
He doesn't feel it. It's a great method. So you only have to remember that one once a month.
And that too, also the hormones then are secreted through the
vaginal
skin.
walls. Exactly. Patients are often a little leery about that at first, but once they see how easy it is to insert and take out,
So can you insert it and take it out yourself?
You can.
Absolutely.
So I imagine there's a string then that you pull on
Nope.
to.
Actually, I wish we would have brought
I
one.
wish we'd have
You
brought
just stick your finger into the vagina, catch
which
part
is
of
the
it.
way you remove a diaphragm.
Exactly.
Anyone
The
that's
same
used
way.
that.
And that's what I
Absolutely.
compare it to often. And with the NuvaRing, as long as it's in right. Whereas a diaphragm, you do have to be fitted for it. It's a great barrier method for a lot of women, but you have to remember to put it in each time you have sex. You have to use a spermicide with it, and it has to be fitted to your
Do
body.
you need some instruction with this ring?
No,
Can you purchase it over the counter in
you
the store?
can't. It is a prescription
prescription.
medication. The pill, the patch, the ring, the Depo-Provera, which is the next method I'm going to discuss, is a shot you get once every 12 weeks. Again, women like it because they don't have to remember it 4 times a year. So each one has their pros and cons for sure. Then there's the IUD. There are 2 different types of IUDs that are available.
And women historically have been in the last, they were very popular when I was in college. This is in the 1970s. But women became very wary because I believe it was the copper T, is that what it was
Dalkon
called?
Shield.
Dalkon Shield,
Yep.
that's right. That was causing scarring.
Right.
And bleeding and pain,
Infertility.
infertility, right. But now it's used in other areas of the world very
Europe, it's like
prevalently.
80% of the women use it. It's a great method. It's not caught on as well in the United States, but it's a wonderful method for women to use. It can be used for up to 5 years or even up to 10 years after. You know, if you're not sure if you're ready to stop your childbearing, this is a good alternative to sterilization.
And again, it's just inserted and you forget it's there.
Yep.
And
Check your strings once a month to make sure it's still there, and you can go up. You know, it's really a great, great method.
And all these are available through Planned Parenthood, all the methods that you've described.
We have the IUD. We have to make sure our doctor's on staff, but yeah, we can definitely at least give referrals. But yeah, the other ones you can pick up, have a prescription written, and then condoms. Always a great method.
Absolutely.
Male and female
Male
condoms.
and female condoms.
And cervical cap and the diaphragm are still available.
We should describe how the female condoms work. 'Cause
Okay.
some people may not be familiar with that, but I imagine they look very much like the male condom,
They're
They're a bit wider. They're the
Yeah.
same length as a male condom. They're only a bit wider.
and they're inserted into the vagina,
Yes.
and they're used the same way. Then the penis kind of inserts into this condom, that's in the, but it's in the female.
vagina. Right.
Let me ask you about male methods of contraception.
Okay.
Obviously, we know about the male condom.
Right.
Are there other methods for
That's
men
it
to
for
use?
men. At this time, I keep hearing studies that there's going to be like a male pill.
Absolutely. It's in the pipeline, but
yeah.
I think they're having some difficulties with the development of it. But I've read
Right.
research as well. Scientists
So-
are working on it.
We'd love for men to be able to be more involved with contraception. You know, I love it when boyfriends or husbands come in to pick up their women's form of birth control. And I was like, thank you for coming in and being involved.
I think this is a real social consideration, though, because really it's women, aside from sexually transmitted infections, which both can get, it's really the women who bear the social brunt of sex, of pregnancy,
Right.
Right,
of
absolutely.
unwanted pregnancy. So they're the ones who are going to be a lot more conscious about protecting themselves. And whereas, of course, men don't want to be fathers unnecessarily, or they want to be fathers,
Right.
and they want to protect themselves if they don't. Still, they're not the ones who become pregnant.
Right.
So I
Right.
think that's one of the reasons there hasn't been a focus on developing
And our boys
something.
I think it's something that boys miss in their education is about birth control and contraception, because it takes two, both of you are involved. So, yeah.
Absolutely.
And another thing Kate talks about is healthy relationships. So that's starting to get that conversation started at a younger age.
Let's talk a little bit about how parents can talk to their children about sex, because this is a very uncomfortable thing for a lot
It
of
is.
parents.
It is.
You, Kate, do it all the time.
I
You go
do.
into schools, and it sounds like you do a fabulous job. I mean, you
Thank
really
you.
make it fun. You engage the kids. You really make them learn this stuff, and obviously they learn that it's very important. What advice would you give to parents on how to approach their children about some very serious, because we're talking not just about where babies come from
Right.
these days, but
Absolutely.
we're talking about the fact that sex can be literally life-threatening, because HIV is a very serious
Absolutely.
illness. So how do you balance the fact that you want to teach your children that sex is really something that's very healthy and very pleasurable on the one hand, and on the other hand, dangerous? How do you convey that to your children?
I think the first thing to do is be honest with them. I think honesty is really important with kids, and the moment they sense that you're not being honest with them, they tend to back off.
Oh, kids have radar.
And not trust.
And
They
also,
do.
not just, even if you're embarrassed, they sense it. And if you convey embarrassment, then, this is something to be embarrassed about, and they kind of internalize that. And
It's
you don't-
okay to be
But
embarrassed.
it's okay to be embarrassed, and that's another thing I always tell parents, because everyone gets embarrassed, and it's okay. And I tell the kids that in class. I said, you know what, sometimes these topics are embarrassing, and sometimes we might feel embarrassed, and sometimes we might need to giggle a little bit. And that's really okay, and it's a normal feeling, and it's a normal emotion, and if we feel that way, we'll feel that way, and then we'll work past it. So I always tell parents, if you feel embarrassed, that's okay.
Kate even has admitted, I'll
I
call you
have.
out on this, and she's
I
got this
have.
great flush reflex.
I do.
And sometimes,
I
even
do.
after doing this for a number of years
Absolutely.
and being so comfortable, she'll get a question that's embarrassing, but it's okay. These are
And
hard
once your
topics to
face
talk
is
about.
red, you can't go
deny
back.
it,
You
Right.
can't go back, Can
you remember
it's
one of the
there.
questions that embarrassed you?
Oh man, not,
hard
off,
to
not off
say.
the top of my head, I
Well,
can't.
well,
no.
let me ask you, let's talk about some of the funding problems that Planned Parenthood's been having, because I think it's clear now that the services you offer are invaluable to communities. I mean, we are talking
Yes.
about some really basic health
health
care. And Planned Parenthood is suffering across the country some really serious funding cutbacks. Tell us a little bit about that. Basically, it's the federal funding that's been cut back.
Right. We have federal funding. It's called Title X funding. It's through the federal government that provides family planning dollars to offer family planning services. It has been straight line budgeted since 1980. However, healthcare in the last 25 years has skyrocketed. So it's hard to provide the same number of services, the same level of care to patients with the same number of dollars. Planned Parenthoods are often not looked at favorably, so the funding has often been diverted to other healthcare agencies.
Well, I think we can be honest here and say one of the reasons it hasn't been looked at favorably is the political climate. And what Planned Parenthood is about is preventing unwanted pregnancies and
Exactly.
preventing abortion.
Yes.
And it's but somehow, because of reproductive health, it's been associated with abortion.
Right.
And I think what we should say here is what you people are about is preventing unwanted pregnancies.
That's our number one concern.
No
Number
one.
one.
Yeah, exactly.
I wish no one had to have an unplanned pregnancy. It's just unfortunately sometimes contraception fails or things in their lives prevent the use of contraception.
And so unfortunately, that's one of the reasons that federal funding has been cut back, because of this stigma having to do with abortion. And the truth is, we're talking about preventing abortion
Right,
here.
and none of those dollars are used for abortion.
What
They're
can
all for
people do
family
if they
planning.
want to support Planned Parenthood?
Know what our lawmakers are doing. Ohio is a state that's not as favorable toward the laws towards women and reproductive health. Another thing they can do is give donations to the local Planned Parenthoods. If you donate to the local Planned Parenthood, that money stays in the community. Also donate to Planned Parenthood Federation, because that helps support the affiliates across the country, but the local affiliates are where the donations really can be
Thank
used.
you both so much. This
Absolutely.
has really been a fun conversation. Thanks to Lisa Wolfe and Kate Huebner for joining us today on Health Vision to discuss the services offered by Planned Parenthood. For upcoming episodes, viewer feedback, and links to important information on health, log on to our website at the address that appears on your screen. Thanks for joining us on Health Vision, a production of WOUB Public Television.
Great, thank you.